I think is a critical one. Yes, when you look at the health sector and the attainment of universal health coverage and sustainable development goals, it becomes a critical situation in the health sector. The nurses, Nigerian nurses and midwives actually are the epicenter of these activities where it results. And the essence of healthcare is to provide qualitative healthcare that is safe and then accessible to the beneficiaries or the healthcare seekers. Now let us look at the Nigerian population, which is over 220 million. We analytically look at how many nurses are employed. Few are employed. And as a result of the number that are employed, many are roaming about, but those that are employed are overutilized in such a manner that in a particular unit, you may have few nurses that are employed, but they have high workload that even when we ask the government to employ, it is rather politicized instead of employing more hands. And we know that we cannot achieve universal health coverage and sustainable development without having adequate number of nurses and midwives. To what extent are the nurses being taken care of? That has been an issue. There is no way you can talk about brain drain without talking about the push factors and the pull factors. Our other colleagues, the medical doctors, have made it clear that there are push factors and pull factors. Now, centering on conditions of service of the healthcare workers, all inclusive, the nurses are entirely at the disadvantaged side. Because if you look at the population of Nigeria at 220 million, you now look at the ratio of patient-nurse ratio as provided by World Health Organization. That has become a total mirage. Talk less about the critical situation whereby you need to have at least one nurse to 4 patients. But all these things are mirage. So basically, we look at the conditions of service. Up till now, the government is trying to address the issue of conditions of service of nurses. Looking at employment rate. So the policies that characterize the health sector actually need to be addressed. Not that I'm not speaking on one side, the government in themselves are doing so well to equip the health sector. But such equipments are underutilized and then maintenance is poor. Equipment can be available, but to maintain it becomes another issue. Equipment can be available, to utilize it becomes another issue. So basically, it is important that a good environment needs to be established. And this good environment requires effective teamwork. There is no health sector that can work without teamwork. The medical doctors are critical, the nurses are critical, the pharmacists are critical, the medical lab scientists are critical. And we need to work as a team. Without teamwork, we can achieve a little. And looking at the health sector, every person is in a critical position to lead the health. It could be anybody, the nurse, the doctor, a relation. Now, if we are not working together, what are we likely to achieve? Nothing. The system will suffer. And for us to work as a team, we need to objectively look at issues that concern each professional group without dominance or thinking that the other professional group are not relevant. Every professional group is relevant to the health sector, and what aspect need to be addressed. Nobody can clap with one hand. You need the 2 hands to clap for anybody to hear. Therefore, we need to specifically look at teamwork because no one can do it alone. Any health sector without nurses and midwives is entirely a different thing. So when the nurses are forced to pick areas of greater function, it's not as if they cannot work here in Nigeria. It's simply an attempt to survive because after school, you need to do other, you need to be engaged so that you can help yourself, help the family, and help the society. And definitely, we all need to serve Nigeria that produce us. Even when people live outside the country, your parents are in Nigeria. When they are sick, who is going to care for them? Will you be able to take them outside Nigeria like the politicians who can afford it? So most importantly, the conditions of service of nurses and midwives need to be addressed. And then we need to establish holistic teamwork so that we can actually move. Then, of course, a lot of nurses need to be employed because many that are not employed are now taking private jobs that are, honestly, they are not getting anything. And that is why majority that are not employed are leaving Nigeria in search of greener pastures.